On average, Americans consume about 4 alcoholic beverages a week, which is a monthly drink tally that might look something like this, Dr. Berman, which is fairly reasonable. But that's not the case for our next guest.
Yeah, our next guest was so entrenched in alcoholism that he drank a bottle of rum a day. That is 30 bottles a month. That's 1,183 shots.
And when we first met Todd, he was hiding bottles of rum underneath the blankets in his bed, tissues, sopping with his own vomit, overflowed his trash can. In a groundbreaking attempt to save his life, Todd admitted to us that he needed help.
Todd and I got married on March 17th, 2001. Todd was really outgoing. He was really successful. Jackson was born January 12th, 2005. Todd's drinking accelerated around the time Jackson was born. When Todd would drink, he would be very nasty with me. The breaking point was when we went on vacation. We had a complete meltdown. So the next morning, I told him it wasn't working out anymore and he needed to leave. And that was the last he's ever lived with us. In the last couple months, his appearance has changed drastically to the point where I don't even recognize him.
Oh God, I'm dying. And I don't know what the hell happened to me. Okay, I'm gonna throw up.
Todd hasn't seen Jackson in about 3 months. I don't want Jackson to see his father in the state that he is.
Drinking has ruined my life. I've lost my house, my son. I've lost my family. I am absolutely at rock bottom. It's just so sad because I care about her and I love my son so much.
My biggest fear is that my son would have to bury his father and grow up knowing that his dad chose alcohol over him.
I love him more than anything in the wide world. I'm such a mess.
I don't think anything can replace your own dad. I think he could do much better with his father in his life.
I gotta get better.
Alcoholism takes such a huge emotional, physical toll on the body.
Mind, body, and spirit.
And I think what people need to understand is when you start talking about alcoholism, every single organ in your body is affected. If you look at someone who's an alcoholic, just the simple act of drinking alcohol all the time can cause alcoholic gastritis, constant irritation of the lining of your stomach, and of course, that can lead acutely to vomiting. But that's not all. The biggest issue for a lot of alcoholics is liver disease. You get alcoholic hepatitis, which over time leads to cirrhosis, a condition which will not repair itself once it gets to the end stage. Your heart, look, a drink a day or 2 drinks a day for men may be heart healthy, but alcoholics actually suffer often from something known as cardiomyopathy. They are also at an increased risk for heart attacks. Now, one of the things you'll often see is alcohol causes dilation of the blood vessels, which is why some people you'll see when they drink a lot, they'll actually get flushing of their face because of those blood vessels expanding. The other thing people never talk about is when you're an alcoholic, it suppresses your immune system. You're more likely to get sick from either acute infections that are mild, like a cold, or more severe infections that can be life-threatening. Joints, you're more likely to develop gout if you're an alcoholic. But maybe some of the most acute effects that you're going to see are in the brain. Alcoholics, their cerebral cortex, that's the decision-making area of the brain, in particular your frontal lobe. Your frontal lobe is absolutely essential to make smart decisions. Alcoholics sometimes lose that greater decision-making ability while they're drinking. The cerebellum controls coordination and balance. That's why alcoholics over time, you'll notice them. They have awkward gaits and difficulty with their balance. The hippocampus, that's an area where we create memories. Alcoholics have difficulty forming memories. And some of the most baseline, basic things we do, our medulla controls our breathing rate, Dr. Berman. With alcoholics, this area is even affected where breathing rates can be suppressed. Even body temperatures can be lower than the normal population. Why am I so passionate about this? Because 17.2 million people in the U.S. suffer from alcohol abuse.
So, I mean, what do you do?
Well, that's the difficult part, because alcoholism is a disease.
That's progressive.
A true disease that is progressive. It's an addiction. Todd was desperate to save his own life, willing to try almost anything.
And that we're comprehensive. Most addiction treatment modalities don't treat the physical component. We treat them with a specially compounded Naltrexone implant, which significantly reduces or eliminates the cravings for alcohol.
Hi, Jeremy. Nice to see you.
Good to see you.
So Jeremy was actually a child actor and a child star in the show Growing Pains. He was a miserable alcoholic for over a decade.
I was struggling very badly with alcohol. I went through the program and was successful with it, and it helped me to stop drinking. They approached me about coming on full-time as a patient advocate, and I pretty much just jumped at the chance. I know exactly where you're coming from. From the time you and I first talked, I could hear how desperate you truly were.
I gotta get my son back. Because now I have supervised visits, and it's killing me.
And that is why I think you're going to be incredibly successful with this.
What we have is a medicine which is very effective at blocking cravings. By treating and virtually eliminating the cravings to drink, our life coaches can speak to you, not the addiction. Todd's at that point. And you're seeing all the manifestations of this disease. He's lost his job. He's in home, in bed. He's malnourished. He's depleted of vitamins and nutrients. He's killing himself. He wants to quit. He's desperate, and he's ready. What we have is a medicine called Naltrexone, which significantly reduces or eliminates the cravings for alcohol.
From the time you and I first talked, I could hear how desperate you truly were.
I gotta get my son back.
And that is why I think you're going to be incredibly successful with this.
Dr. Berman, you wanted to explain a little bit about what naltrexone is and how it works.
Naltrexone is a dopamine antagonist, so it blocks, the pleasure-seeking impulses that alcoholics and addicts have. And traditionally, this has been an oral medication that you take as a pill. And the problem with that has been, and the challenge for us as healthcare professionals, is that people obviously don't want to take it.
So
right?
Todd he's tried everything, and I think he came to you finally out of desperation, willing to try anything that may help him. So you actually used an implant where it slowly releases naltrexone.
Right. And this is introduced subcutaneously through a very small procedure in the right lower quadrant of the abdomen, and it slowly releases this medication in very low doses over a number of months. It depends on the individual, their metabolism, but long term, which allows them then, without the cravings, that they can absorb, ingest, and digest the teachings and the coachings of their counselors, of their group sessions, deal with the triggers, have the tools, accumulate all these things so they can, within the framework of their own lives, they can deal with all of these triggers.
And just 1 week ago, Todd had the implant procedure performed.
Todd has done very good. Today's the day that he'll have the naltrexone implant surgically placed in the right lower quadrant of his abdomen.
I craved alcohol like you wouldn't believe going through detox.
Right after surgery, the medication is absorbed into the body rapidly, and our patients report that even on the ride home, their cravings for alcohol are diminished.
I am so excited about not drinking. I've never been this excited in my life.
This is the naltrexone implant that we have specially made. Right now he's placed the syringe in the tunnel. How you doing, bud?
Good.
So the implants are in place.
All right.
You're now on the road to recovery.
I'm excited. I'm really excited.
In more ways than one.
So that was 1 week ago. Todd joins us today. And Todd, first of all, thank you for sharing your story with us.
Oh, thank you.
And I also want to emphasize that Todd is just beginning his long journey. Alcohol abuse is a very serious thing. And I imagine this last week has not been an easy one for you.
It's surreal. It's mind-boggling. I haven't had one craving whatsoever.
I want to be very clear that this isn't a panacea. You had him on some other medications to help with those
Absolutely.
withdrawal symptoms.
During the initial detox.
We'd evaluate him and replete a number of electrolytes, provide him with vitamins. We gave him long-acting Librium, benzodiazepine, and Ativan. And he came through the withdrawal fine, safely, comfortably. Also letting him know if you get very tremulous or anything more significant, that you have to go to the emergency room.
And you met Jeremy. And Jeremy Miller, you all know him as the lovable Ben Seaver on Growing Pains. And Jeremy, as a recovering alcoholic, you've now dedicated your life to helping people like Todd overcome their addiction and sharing some of your own personal experiences with it.
Absolutely. I mean, I struggled every single day for 15 years. I honestly tried many, many different ways to get sober until I found this program. Nothing worked. This was a savior for me.
Do you still have the implant?
No, the implant, I had mine done a little more than 2.5 years ago, so it has long since dissolved. But I went through the life coaching program, which is a very, very crucial part of it. You know, the medicine's a wonderful tool, but the life coaching is where you get the skills in life and the emotional skills, the mental, spiritual skills to be able to stay sober long term.
So what do you coach a guy like Todd to do now?
I tell him, I mean, Todd, you got to keep doing the work. Your life coaching is crucial. Working with Terry one-on-one, you have to keep up with your sessions. You have to keep doing the work.
And I would like to encourage anyone out there, if you're struggling with alcohol abuse or you know someone who is, reach out for help. There are so many people who are willing to help provide you with that help. Thank you so much for joining us.
Thank you.
Thank you.